day, sir. I am Angela Ramos from BSN 1D and I will be doing the return demonstration for bed bath. The purpose of bed bath is to eliminate transient microorganisms, secretions, excretions, and dead skin cells. It is also done to promote client comfort and relaxation, and to stimulate the circulation of the skin. And lastly is to eliminate or to prevent unpleasant body odors. The materials needed are 2 bath basins, soap dish, gloves, clean gown, hamper, linens, which are the waterproof pad, uh, two bath two bath towels, washcloth, and bed bath blanket and warm water. First of all is the assessment. So first, we will identify the client so that we will know if the procedure is appropriate for him or for her. And then we will explain the procedure that we will be doing and ask for cooperation. So sir, I am gonna do today is the bed bath. I am asking you to please cooperate and follow the instructions that I will be giving. And first, for the planning, first we should wash our hands. After washing our hands, we will remove all the unnecessary things that may hinder us in doing the bed bath properly. Next is to arrange all the things that we will be needing. Next is we will now provide privacy to the client. We should close all the doors, all the curtains, and all the air conditioning units. After that, we will raise the bed into a comfortable working position and raise the side rails. And then we will invite a family member or a guardian if desired by the client. And after that, we will offer bedpan or urinals if the client wanted to. And now we will wash our hands and put our gloves on. After that, we will now move on to the implementation. So first, we will loosen the top sheet of the bed. After we loosen it, we will replace it with a bath blanket. And then we will now remove the top sheet. So we will remove the top sheet by rolling it down the client's body or the bed. And now we will place it into the laundry hamper. And after doing that, we will now remove the clothing of the client or the hospital gown. If we will remove the gown, we should fold it inwards. Assuming the clients have already removed its gown or clothing, we will now fill the 2 bath basin with 1/2 or 2/3 of the water. After filling the basin with 1/2 or 2/3 of the water, we will put the necessary amount of hot water so that we could achieve our desired temperature. after that, yan, we've already finished putting in the bath blanket of the client. Then the next one is putting in a bath towel at the head part of the client. So we need to remove the client's pillow first. Lay the bath towel across the head of the client. After that, we will put newspaper or any waterproof pad at a place where we will put the bath basin. And then after that, we will now wet our washcloth. So after that, we will now or make a mitt using this washcloth in our hand. So first, we will put the washcloth across. Ayan. We will put our hands in front of the washcloth and fold the first half across our palm and then the other half. And after doing that, we will pull down the remaining cloth of the towel, and then we will tuck it in where we folded the towel so that it will be secure. So first, we will clean the eye area of the patient. So in cleaning the eye area, we will first clean the inner cannula up to the outer cannula. And after that, we will ask our patient if we need or if he wants to use soap for his face. So, sir, do you want to use soap for... So now we will move on to the washing of the patient's eye. So from the inner cannula to the outer cannula. So the inner cannula to the outer cannula. So we will wash the eyes at the different corners of the towel. And then at the opposite corner. Yeah. After that, we will use also this mitt for the eyes, the neck, and the ears of the client. For the face, neck, and the ears of the client. And we will clean it using firm S strokes. After doing that, if soap is used, we will rinse the face of the client for 2 to 3 times and then pat it dry. So now we will pat the face dry with a dry bath towel. And then after that, we will now move to the farther arm of the client. So first, we will now expose the farther arm of the client. After that, we will now wash the arm from the distal to the proximal area. So first is from the fingers to the elbows to the axillary part using the washcloth. So we will pay particular attention at the spaces between the fingers and the nails. So here. Then after doing that, we will rinse it if soap is used and then pat it dry. And then after that, we will also do the same at the other arm. Rinse and then pat dry. And then after that, we will now expose the client's abdomen and chest part. So we will now fold the bath blanket up to the pubic area. Yeah. After that, we will now we will now wash the chest and abdomen area of the client, paying particular attention to the umbilical and the breast area of the client. So pay breast area, paying extra attention for the breast area and the umbilical area of the client. Then after that, if soap is used, we will rinse it and pat it dry. And after that, we will use grooming kits such as powder, lotion. It is also included in the materials needed. So we will now powder the neck and the umbilical, the area below the breast. And the area below the breast. After that, we will now move on to the thigh part. So we will expose the farther thigh first, just like the thing that we did in the arm. Now we will wash. We will flex the knee of the patient. And then we will now proceed to the wash. Wash it off. From the distal to the proximal area. And then after that, we will rinse and then pat it dry. And then to the other arm, other leg. Flex the knee. And then from the distal to the proximal area. And then if soap is used, rinse 2 to 3 times and pat it dry. And after that, we will now move on to the perineal area. In washing the perineal area, we should flex both knees of the client. And then drape it. As if the client may be able to wash the perineal area on his or on her own. And then after that, after finishing it, we will now move on to the washing of the feet of the client. We will take a bath basin, and then we will place our palm at the heel of the client's feet, and then put it in the water. And then we will now clean the feet of the client. So we should pay particular attention to the spaces between the fingers, the toenails. And then and then pat it dry. Rinse and then pat it dry. And then we will do the same at the opposite foot. We will place the heel at the palm of our hand and place it at the basin. And then wash the feet of the client. Then after that, we will pat it dry. And then we will now change the water and we will proceed at the back of the client. So first, at the back of so we will now expose the posterior part of the client. And then place a bath towel near the client's body and start wiping it to the way that we did at the anterior part of the body. So from distal to proximal, and then the neck, and then the neck, the arms, the back of the client, and from the inguinal to the popliteal part. And then after that, we will rinse it and then pat it dry. After doing that, we will now assist the client in supine position. And then we will assist the client in supine position and for his grooming aids, and then assist him in changing his gown, hair care, oral care, nail care, and now at the last part, we will now make an occupied bed. After making an occupied bed, we will now wash our hands. And for the evaluation, at the evaluation, we will evaluate the strength of the client and to the percentage how the client did the bed bath without assistance. And then at the documentation, we will document the client's responses at the treatment and his skin condition.